Hello everyone, this is Michael again with AA Medical Store. Another educational series video, color reproduction, money settings on the actual display. So one thing to remember, you either have a source which outputs a video signal, you have a device that captures that video signal, and then you have a display that shows that video signal. So what we're gonna try to talk about today and really dial in is getting the correct display settings on a video monitor. The most important thing to always remember whenever you're using a video system is to make sure that you white balance. And white balance is telling the camera that white is white. Once it knows white is white, then it's gonna know red is red, blue is blue, green is green. So very important to remember, and one of the steps that I think gets missed sometimes when you plug the camera in. So you want to dial in money settings for a surgeon. There's a couple of ways you can do that. You can either preset the display to show that specific surgeon every single time, or you can go in and manually change the settings once he's in there and he's not satisfied with the color reproduction. Again, color reproduction is just how it's being shown on the display. So you can change that. And when we change it, you're definitely gonna be able to tell the difference between one from the other. For this demonstration purposes, we're using a Stryker 1488 camera system, and we're using a Vision Pro sync monitor. As you can tell, it's always a good idea whenever you're hooking up any video system is to turn the camera box on, plug it into the monitor, so it's gonna come out of the camera box and it's gonna go into the monitor. Once you do that, if you turn the camera control unit on or CCU, you're gonna see color bars on the screen. It's not gonna show you the exact color that's gonna be displayed on the display, but at least you know you have the video signal running through there. So very important to make sure that you have a signal, and one way to tell that you have a signal is by having color bars on the monitor. So we're gonna line this up. We're gonna go ahead and plug this in. Now, we talked earlier about what's the first thing you wanna do whenever you plug a camera into the camera system is you wanna white balance, right? Three main things you wanna remember when you're white balancing. Number one, the picture should be all white. Number two, the picture should be in focus. And number three, the picture should not have any glaring. If you have glaring in your image, it's definitely gonna affect your white balance. So basically how Stryker's system is set up is we would shine this on something white, and then we would push and hold the W button on the camera head, and it lets us know that the white balance is in progress and that the white balance is complete. Again, when you're talking about color settings and you're talking about a display, you want to first start off and see what you have as an actual display, right? So we want to focus in on the image, and we want to look at something red, then we want to look at something green, then we want to look at something blue. So once we know we have red, green, and blue, then we can fine tune or adjust from there. But we know that we have some pretty good color settings already, just based on looking at red, green, and blue. To get into the color settings on the actual display, there's a sequence that you have to do. The one thing you want to do is you want to push the button, and then you want to scroll. Right now you're in the brightness setting. For the Vision Pro displays, you need to make sure if you want to change your brightness, you highlight brightness, you get a red dot on the left, and then once you get that red dot, you can turn it up or down. Now, what they've done, what Stryker's done, is put kind of a middle ground setting or a 50, and that's gonna be highlighted in orange. And then if you wanna go up and down from there, you would definitely see that it's gonna go away from the orange, and you can definitely tell the picture is changing. To then change to the next setting, if you wanna change your image sharpness, you would scroll down to image sharpness, get the dot on the side, and then you would turn it up from there. So that's the nice part. When you want to exit, you can either push and hold the knob, or just go to exit. So push and hold and it's gonna get rid of the overlay or the on-screen display. So now, what we wanna do is we wanna get into a specific specialty setting in the monitor. Again, this is where I talked about originally when we first started this video, is where we could set a setting for a specific surgeon. And the way you do that is by going to the specialty button on the monitor. And are we gonna do normal? Are we gonna do PACS? Are we gonna do ENT? Let's do ENT because the red on the ENT, it looks a little different. So basically we're gonna go to ENT, we're gonna hit our red, and then we're gonna scroll up and we're gonna get more red, or we're gonna scroll down and we're gonna get less red. The thing to remember is you wanna do it in small increments. So you wouldn't wanna go from 20 to -50 all at once. You wanna go 20, maybe 10, maybe 15, then 20, 25, 30, and just get it to where he's comfortable with that image. So the other thing would be then you're changing your blue or your green, but then your gamma. So think of gamma as the richness of the picture or the color saturation as in general. So almost like a black and white image or a deep, rich color image, that's gonna be your gamma. So we're gonna select gamma, we're gonna select it there, and then we're gonna go from there. So as you can tell, 2.5 to S0. Look at the difference on the actual display. One's brightening it up, one's dulling it down, right? And then you can scroll from there. So again, with the Stryker system and the way it's set up, they have it set up in the S2 as kind of the standard variation. You can always adjust from there, especially if the surgeon doesn't like it, you can definitely adjust it. But these are where Stryker thinks that it should be for this specific display. Thank you very much for watching. Hopefully this has helped. If you need more information on money settings or display settings, please don't hesitate to reach out to us. Thanks again and have a great day.